Then, of course, we have costs. Within each country, we try to identify what the patient costs are, the program costs, and we added another one being training costs, the number of people we need to train if we want to scale up an intervention. In a lot of low and middle income countries, it's not the whole population that is being covered under healthcare services, and we want to increase the coverage of breast cancer care within those countries. Of course, it has been mentioned by other people as well, that if we want to do that, we need more oncologists, we need more surgeons, etc. What are the costs of training those people? That is, that we take into account as well. The effects of the interventions, effects are, of interventions cause an effect through a lower case fatality rate, a changed stage distribution. You can imagine if you start screening patients, you will find more patients in stage 1 and 2 breast cancer, and hopefully less people will come to the hospital with a stage 3 or stage 4 disease. And change disability rates. So the quality of life of patients will go up as well. Think, for instance, of palliative care, whereby the level of suffering is decreased. Okay, real quickly, the breast cancer scenarios that we have developed in this model, and this is all based upon academic literature. Think of like journals like The Lancet, New England Journal of Medicine. Big trials have been done to test what is the efficacy of mammography in certain age groups. What is the impact of treating stage 1, stage 2, etc. And we have developed, we also combine certain of these interventions together. For instance, we also look at basic awareness and outreach programs. Mrs. Wiafa already told that in Ghana there are very much NGOs who are working on that, because a lot of females don't know what breast cancer is, and basically once there's no awareness, people of course will not go to a doctor, and that is modeled as in volunteers going to villages, etc., explaining what breast cancer is, etc., and we calculated what the expected effects are of those strategies. Okay, preliminary results for Ghana and Jordan, stage 1 to 4 treatment with a basic awareness outreach program and a mass media campaign, being spots on the radio or on television, letting people know, informing them about breast cancer, because, well, as I said, in low middle income countries, a lot of people do not know what breast cancer is, or unaware, was the most cost-effective intervention, which means putting your money in this kind of interventions likely will give you the biggest bang for the buck in the future. For Costa Rica, it was a bit different. As Cecilia already mentioned, the countries differ tremendously, and therefore tailoring this model to a specific country gives us different results. Their stage 1 to 4 treatment with biannual mammography screening was the most cost effective, and then specifically for females in the age range of 50 to 70 years. However, as we are still in the process of tailoring these models to the country-specific context, it should be known that these are the outcomes mostly based upon the regional data within the WHO Choice project. As of presently, we are trying to gather the data that are country-specific, and indeed for all countries goes, when country-specific data become available, and especially stage distributions, because that turns out to have a huge impact upon the effectiveness of various treatments, these outcomes in all likelihood will change. So the future, as such, these might lead us to different conclusions. Lessons learned within this project. It is essential that we have a strong support from the WHO country office, and of course the need for a strong and motivated project team within each country is very important as well, because basically we work together with the countries, and as such we facilitate, and hopefully we find these motivated teams in the other countries that we will be going to For me personally, we will do this research also in Brazil and Mexico. I saw some people from those two countries are also here, so I would be very much interested to meet you, but that on the side. The need for flexibility, very important. Remember, a plan is just a plan, as I personally experienced when I went to Costa Rica, because as you all know, we had a volcano in Iceland, and my colleagues couldn't make it to Costa Rica. So basically, things happen, and I was on my own, or tried to run that part of the project that I could do by myself. So no battle plan ever survives contact with the enemy. And as such, we hope, we got great support from Costa Rica, and of course, we hope to get that from the other countries as well. So thank you very much for your attention, and any questions are welcome.